And while I mean, this is a talk about men because I mainly deal with male problems, and my partners deal with the I've associated deal with female problems, and of course there's a couple of problems. The whole issue about sexuality and aging and in men with HIV, it's very different these days, because when I started practicing in sexual medicine in the 1990s, when HIV and all this AIDS were raging, it was a very different story. That men with HIV were very low in testosterone. Most of them had erectile dysfunction, and it was all the other health problems. But today, of course, it's a very different world. Men with HIV are just like have that illness has no impact on their lives in general. And as we age, we all have changes in our sexual functioning. So this is more a generic or general talk about what happens to men as they age and how things sort of work. And I can give this talk in about 2 hours, but I'm cutting it down to 15 minutes. So I hope that's okay. All right. So let's just get the ball rolling. So look, just in general, men have different health needs according to their age. I mean, that's an obvious thing. But, we have the issues of younger men. Teenagers and men in their 20s have more issues about, STIs and testicular torsion and stuff like that. And older men, once we get a bit into our 30s and 40s, we start to worry about, our weight, diabetes, blood pressure, depression, that sort of stuff. And in the 50s and 60s, it's more about, bowel cancer, prostate enlargement, sexual problems, work retrenchment or work burnout. And often, as aging men, have elderly parents to look after, and that's a real challenge. And often these days, with the financial situations, children come back home when everyone thinks they have a nice, peaceful time in their retirement, because they can't afford to live out of the house, and that's another stress. And once we get into our very senior years, we've got issues. We need to keep our weight down, prevent osteoporosis, joint pain, keep our brain alive, cognitive function, and there's all things around retirement and financial things, and keeping immunization up to date. Now, we have a concept about men's health check. This was introduced, I think, by Andrology Australia many years ago. The idea is that a man should have a health check because his body is like his car. He often has more interest in his car than his body, or at least in the old days when cars needed to be worked on. These days, modern cars don't need a lot of stuff. But, the concept is look after yourself like you look after your car, and think of your body as being a toolbox, and keep it all, in fine tune. So look after yourself. This is like an idea that works very well for some men. Look, the problem is being overweight is a real big problem in Australia or in the world these days, and there's a lot of issues around obesity and being overweight. And how we work these days is we look more at waist circumference than at actual weight. And in an ideal world, a Caucasian male, a white male, should not have a waist circumference of more than 94 centimeters, rather than looking at his actual weight. And the female should be 80 centimeters. But we all know that, like some Asian men have a much smaller waist than women. And Pacific Islanders, the guys, from Samoa, the people who outside nightclubs, the security, they're all very big people. And their waist circumference is often up to 110 centimeters. Down the bottom right is a pear, and on the bottom left is an apple. Men, when you get the apple shape of obesity, that is around the central stomach, that's a much more unhealthy weight than what women get. Women before menopause get more of a weight around their bottom and their thighs. And as much as they may not like it, it's not as unhealthy as the central adiposity is. So the fat bottom and thighs is a much healthier thing. But when women go through menopause and they lose the protection of estrogen, they get the same problems like men. Their stomach gets fat. The NHMRC, National Health Foundation, are always talking about exercise and how we should do at least 30 minutes a day of exercise, and climb the stairs, walk the dog, get off the bus, stop early, and all that sort of stuff. The NH and MRC has also worked on alcohol. Now, we really believe that everyone should have at least 2 days a week where they don't drink, and on the other days they should have no more than 2 standard drinks. That's a healthy lifestyle, and you can see here different drinks have different percentages of well, like for example, a 425 ml beer full strength is 1.6 drinks, whereas a 285 ml beer is 1. So you have to be a bit mindful how much you actually are drinking, but 2 standard drinks is what we do recommend. No one agrees that smoking is good for you, but occasionally you might see someone up to 100 years of age smoking, but essentially there's no good comes from smoking. It's nice to have lots of food to eat, healthy food, Mediterranean diet, vegetables, fruit, that sort of stuff. But studies show that less than 4.3% of men eat enough fruit and vegetables, and the idea is aim for 6 servings of colourful vegetables each day with 2 serves of fruit. I remember many years ago, we were all told to eat 4 serves of fruit, and that's changed because there's a fair bit of sugar in fruit. So 2 serves of fruit and a bit of dairy, a bit of protein, and a bit of grains and vegetables. That's the way to go. Now, this unfortunate picture is obviously set in the land of America. This is in a diner, and being overweight is often part of a thing called a metabolic syndrome. A metabolic syndrome is when you have diabetes, you're overweight, you have high blood pressure, and you have high cholesterol, and it is associated. Metabolic syndrome is associated with lots of health problems, not just erectile dysfunction. Now, we know that many men who have metabolic syndrome have erectile dysfunction. Okay, that's that usually goes together. But they often have heart disease. They often have androgen deficiency. That is, they're very low in testosterone, and they often have a very big prostate, and with what we call lower urinary tract symptoms. So, erectile dysfunction is not just a mechanical issue about getting or not getting an erection. It's a significant window into the body to look at any other condition. So whenever I see a guy, especially a guy in the senior years who's got erectile dysfunction, I instantly think of what else could this be, not just a mechanical failure of the blood flow. So as we get older, what happens? Well, this is normal physiology. What I'm about to tell you is normal physiology. This doesn't necessarily mean you have to rush and get treatment. You can, but it's just normal physiology. Now, when is aging an issue in erectile dysfunction? I sometimes see men in their 40s experience what I'm about to tell you, and sometimes there's men in their 80s who have no problem. I don't see them. I only see the men who have problems, but mostly this will eventually happen as you age. It does take longer to get an erection. It just doesn't come as quickly and as sprightly as when you're younger. It's much more difficult to hold. It needs a lot more stimulation. You need a lot more touching and stuff like that. The orgasm may or may not be as intense as it used to be. And if you still ejaculate, some men that stop, they get retrograde ejaculation. It's sometimes only a few drops. It's no longer like a bucket full. The refractory period is important. Now, the time it takes to get an erection and have sexual activity again increases in time. So, it's a problem when you see older men trying to behave like they're 20 or 30, because you can't override the refractory period. You just can't do it. You have to respect it, because the refractory period is what everybody's different. Everybody has its own refractory period, but that refractory period just gets longer with age. It might be up to a week between sexual stability. Everyone's different. As men age, they have medical conditions that also impact on erections, like metabolic syndrome and diabetes and that sort of stuff. Now, we always joke about if you don't use it, you lose it. But there's some sort of sense in that. Like, if a young man doesn't masturbate or have sex, he'll still maintain his erectile function. But as we age, our penis does need to be exercised a little bit more in terms of sexual function. Then if a guy gets in his 60s and 70s and never, ever stimulates himself or someone else does, it may expedite the loss of blood flow. So it does need a bit of exercise, a bit of use as one ages. Now, the big one that we all worry about, and we see a lot of this, is sleep apnea. If you have a guy like this in your waiting room, you can bet he's got sleep apnea. And why we worry about it is that the OSA is obstructive sleep apnea. It is associated with so many health problems: depression, low testosterone, less sexual desire, erectile dysfunction, and endothelial dysfunction. Now, the endothelium is in fact the lining of all blood vessels. And when it becomes dysfunctional, it's not good for blood flow. So sleep apnea is a really, really important condition to treat and fix. It often involves weight loss, but certainly there are other things involved. Now, why don't we change? Oops, sorry, go back. Okay, now, one of the problems out there is, you remember, if in the old days, I think I used to read women's weeklies when I was a bit younger. It was all about, youth and sex and virility and vitality. There has been a sort of thought that older people don't need to have sex, or why should an older couple be in a nursing home, be in the same room, that sort of stuff. Well, that's changing. But, we also need to understand not only older people entitled to sex, all people of all ages, younger people, older people, gay people, everyone's entitled for sexual intimacy. There should be no issue where you say, no, you're too old, or you're too sick, or you're too whatever. Now, this is all driven by testosterone. Testosterone is the male hormone. Believe it or not, women have testosterone as well, but they have about 1/10 the amount of male hormone. And the reason why they have it is that they need, testosterone gives you libido or sexual drive. Without sexual drive, there'll be no reproduction of the species. So everyone needs to feel a little bit horny in order to reproduce. But men, of course, have a lot more testosterone because that gives them their male sexual characteristics. Grow hair on their face and their armpits, their pubic hair, enlarges their testicles and grows their penis and makes their muscles strong, and also helps their bones. So testosterone is the male hormone. Most of you are old enough to remember this ad from years ago. When you ask someone, do you have enough testosterone? It's like, I suppose the question is it like, do you have a tiger in your tank? I say, oh, how's your mojo? Mojo often covers that sort of topic. Look, it's also very everyone's got their own idea about how they feel. Some men may have normal testosterone, but they don't, for other reasons like depression, they may feel they need testosterone. But there's often the wrong thing about what you need testosterone. There's no doubt that testosterone does give you the spark that enables sexual activity to occur. It's not as simple as calling the NRMA to fix that. Now, as we age, actually, I just remembered something in the slide that didn't come up before. As we age, testosterone does drop. It's normal, it's natural, it's just the way it is. Now, we don't realize that our testosterone does drop because it's so slow. Women go through menopause and it's like overnight, virtually a very quick change. Like the testosterone, we have at age 30 and at 60 is quite different, but it's not like we've had a sudden change and we adapt to the change. So, we still have a libido, but maybe not as much testosterone. These are movies, Grumpy Old Men. And, the question is, when you get old and you're grumpy, is it because you've got low testosterone? Because low testosterone makes you grumpy, or does being old just make you grumpy? So this was This was a well-known movie a long time ago. Jack Lemmon and Walter Matthau, both long past, but it was a very fun. It was, I think, it was #1 and #2. I'm sure some of you may have remembered that. So that's all about, are you low in testosterone or are you not? But many people seek testosterone when they think they might need it. Now, the things you get when your testosterone's low, and remember, aging can do it, but the most thing that presents is a decreased libido, like you just don't feel as horny, and your erections aren't as strong, and your ejaculation's a bit slower, delayed. But there are physical changes where you lose your muscle mass, you get fatter around the abdomen, that central adiposity, your bones become less dense, you get osteoporosis, you have less body hair, and you get hot flushes and tachycardia, just like fast pulse, just like women do when they go through menopause. And psychological causes are you get loss of energy, your memory's a bit foggy, your well-being is reduced, you're irritable, depression, insomnia. Now, the trick is some men with depression behave like they got low testosterone, and some men with low testosterone behave like they got depression. So you've got to be really clinically astute what you're dealing with, a mental thing or a physiological thing. Now, this picture on the right is a classic case of it, someone who's born with testosterone deficiency. This is an adult male. He's got boobs, he's got gynecomastia, he's got a large abdomen, he's got very small genitals, and he's quite hairless. So this is a classic case of someone, for example, like with testosterone syndrome. We've got some very good treatments for those who are genuinely low in testosterone, and that's called hypogonadism. And there's injections and there's applications you can put on. The top two you apply on your shoulders. The bottom one on the left is you put on the scrotal skin, and the other one's the injection. Now, I think there's just some basic things one needs to ask. Once you turn 40, I think there's some questions you should ask about your health. What health issues occur at my age? Do I need blood tests? What about prostate? Everyone's worried about prostate cancer. Is a blood test enough? Is my family history important? Is what I feel normal at my age? What can I expect as I get older? Am I at risk of developing any disease? Do I need any screening tests? What changes do I need to make? Are medicines safe, the ones you buy from the chemist? It's important to not to smoke or even passive smoke. Reduce your alcohol, protect your skin, have a good diet. We recommend not eating red meat now more than once a week. I mean, we all grew up on red meat. Almost every day we would have had it, but really it's recommended now no more than once a week. Be active, balance work, family, and recreation, and think about meditation and mindfulness. Now, we've got a very good organization that I do promote. It's called the Healthy Male. It used to be called Andrology Australia, and it's a resource for men of all ages, or for people of all ages, and it's for the public, for doctors, for hospitals. It's got so much information on so much stuff. I could highly recommend it for anyone who wants more information. Now, I have missed out a slide. This is the end, but I'm not going to quite finish yet. I'm just going to go and it's going to try to get out of here. I don't know where that slide disappeared to, but in terms of treatment of erectile dysfunction, I just want to have a few words about the tablets people take. There are a whole lot of treatments, including tablets, penile injections. There's an injection called Cabojet that's currently out of stock throughout the whole world, but hopefully it's coming back one day. And then, of course, there's vacuum devices. But the ones that we know very well, we certainly know Viagra on the top right, and also known as sildenafil. They're all generic, so they're much cheaper. And the other one on the left is Cialis, also now known as tadalafil. These are very good tablets, and if you're well enough to take them, you can't take them if you're not, if you're unwell. You've got to be well enough to engage in sexual activity, and you can't be on nitrate medication. That's a heart medication. The one down the bottom, Spedra, is the newest kid on the block, but it's a little bit expensive because it's still not. It still hasn't come under patent. It's still in patent. So, But these are excellent tablets to take, and they're around. So I haven't gone into detail with all the other treatments, but I'm happy to take any questions. In fact, I'll stop sharing now.